Ethan, this year's retention list. You are not on it.
Dr. Moore, my internship grades. I was the top of my class.
Grades are just a reference. The hospital looks at overall quality.
But my grades...
Enough, Ethan. Some things are more complicated than they seem. All right. Prepare well for the next round of hiring.
How'd it go? What did Dr. Moore say?
I didn't make it.
What? That is impossible. You were the top of our class, the best
If
grades.
you didn't make it, what chance do the rest of us have?
Ha! Exactly!
If only grades were all that mattered.
Sigh. This place is so corrupt. Without connections, you can't compete with the people who have them.
That bastard, Moore, he is just on the take. No way. I am going to give him a piece of my mind!
Save the patient first.
Car crash! Patient is unconscious!
No obvious injuries. No bleeding. Should be okay. What is this? What? I can see his bones and blood vessels. What is happening? Could it be a closed fracture? I just punctured an artery.
1 minute ago, his breathing and heart rate are rising. His blood pressure is dropping.
Any other injuries? Checked for fractures and pneumothorax.
Checked. Nothing there.
Closed fracture. They're hard to detect. If the fractured bone punctured an artery on the way. Dr. Adams, was there any bumping on the way here? Or a sudden stop?
There was some bumping on the way, but I checked. There is no bleeding.
The patient is in critical condition. He is about to go into hemorrhagic shock. Quick, get a tourniquet and the rebo. Everything we need.
Ethan, what are you talking about? Hemorrhagic shock. We haven't even diagnosed him yet.
An intern. Telling Dr. Lane what to do. He's not even admitted yet, and he's already bossing everyone around.
How can you be so sure he is going into hemorrhagic shock? How are you so sure he's going into hemorrhagic shock? He is going into hypovolemic shock.
His right leg is slightly swollen. Plus, the paramedics said they had to brake suddenly on the way here. So, I diagnosed a closed fracture. And the broken bone pierced the femoral artery.
You are just an intern! How dare you show off to Dr. Price? Who do you think you are?
He is the chief of staff?
Then tell me, how did you conclude he is bleeding internally in his right leg?
Femoral artery bleeding.
Ethan was right. But how is that possible? No one saw that before.
Is the patient's CT report ready?
Here is the patient's latest CT report.
It is a closed fracture. Thanks to you, we stopped the bleeding in time. Otherwise, he'd be in hypovolemic shock. Brian, prep for reball.
Yes, Dr. Price.
Dr. Lane, that is not the right spot.
Ethan! You are a fired intern. What nonsense are you spouting? Get out! Dr. Price, I am sorry for this. My apologies. I'll take this hothead away now.
Then, where do you think we should puncture?
I think we should go through the common iliac artery. There's no bleeding there. And the surgical field is clear.
Brilliant! What a perfect entry point. It avoids the bleeding point and gives the ortho team room to work.
Good. He is all yours. Get him to the OR, now.
Yes, sir.
Ethan, you are so talented. Why didn't you get a spot here?
Dr. Price, Ethan's internship grades. He was always first, but Dr. Moore just wouldn't let him stay.
Sonny! Oh, nonsense are you talking? Dr. Price, that is not it. Sure, Ethan has high scores, but his overall performance is lacking. He is lazy on the job and has no teamwork.
Dr. Moore, I'll remember that. In 2 days, all interns will be retested. I'll proctor it myself.
I came from a small town. This chance is too precious. This exam, I had to seize this opportunity.
Master Surgeon System activated. Congratulations, host. New user reward received. Simulation room activated. Skill unlocked. Human anatomy.
Simulation room?
In the simulation room, you can practice infinitely. Your precision will be scored by the system.
Relax.
Points.
Okay.
50 points. Again. 60 points.
Again. Perfect score. Time outside is frozen. And this is incredible.
For this exam, only the top 5 will be eligible to stay as residents. Also, there are 2 external candidates competing with you.
What? External candidates too?
Oh, wow. They look so experienced. How can we compete with them?
Ethan, this is trouble.
Leave it to me.
The exam begins now.
He is a genius. He is done already.
Now, the exam results. Mark Lloyd, 86. Sunny Yates, 85. Alex Chapman.
Dr. Price, you haven't announced Ethan's score.
This exam, only one person got a perfect score. And that is Ethan Carter. This is just the first step. Next is the second step. Human anatomy. The exam begins now. Sunny, you are up first. Dissect the pancreas.
Ne?
Go.
I am done.
Ethan, dissect the spleen. This technique, he doesn't look like an intern. Ethan, have you studied anatomy before?
Well, I practiced in school.
Just in school, and you are this fast. That is incredible.
My hands are still shaking. So this is what a medical genius is.
All right, the exam is over. Now, the final results. 5th place, Sunny Yates. Staying for residency, assigned to the ER. 3rd place, Alex Chapman. Staying for residency, assigned to nephrology. 1st place, Ethan Carter. Staying for residency, assigned to the ER. All right, the exam is over. Back to work, everyone.
So what if Ethan got first place? He is still in the ER that dump. Just wait for my promotion and raise.
Could it be? The one trying to get rid of me is him?
Host has passed the assessment. Reward artificial valve replacement.
Artificial valve replacement. That is a key skill for heart surgery. Great. I've mastered another surgical skill.
Doctor, please save my child! Dr. Lane, the patient suddenly had trouble breathing at home. She is turning blue. They brought her in right away.
Ethan, contact the lab now. Get her to the OR. Got it.
Doctor, save my child!
Don't worry, her test results are in. The report will be here soon.
Dr. Lane, the report.
Has she ever had anything like this before?
No, I don't think so. She's always been healthy.
Right? We don't know what is wrong. Please, doctor, please, save her.
Please calm down. Our cardiac surgery chief is on his way.
Sir, ma'am, please. Don't worry. We're professionals. Please. Don't worry. She is going to be okay.
Surgery now.
Ooh, doctor! Our daughter!
Ethan, want to go in and learn?
Yes.
Okay, I'll arrange for you to observe.
Then, thank you, sir.
That is what I am here for. Go on.
Resident, just observe. Don't touch any instruments. Is that clear?
A true cardiac surgeon. His technique is so skilled.
What is happening?
Heart rate and blood pressure are dropping.
Heart pressure is too high. It is critical. I am not sure. I have to report to Dr. Warren now.
Aortic valve stenosis and regurgitation, pericardial effusion. Just like the simulation last night. Exactly the same.
What do we do now?
We have to replace the valve now and suture the pericardium.
Dr. Ford said to wait for him. What do you know, resident?
We can't wait any longer, and the child will die.
Who is responsible if something goes wrong?
I am.
Stop! Are you crazy?
Blood pressure. It is rising. Heart rate stabilizing. 2.
How is this possible? Even Dr. Ford couldn't do it. He's just a resident. How did he do it?
So fast. I've never seen a doctor operate this fast.
How is the patient? Dr. Warren's on his way.
Dr. Ford, the surgery. It is done.
Done what? Who told you to use the instruments? Such a perfect stitch. He is just a resident. How did he do that? I am screwed. Dr. Warren's a stickler for rules. What if he thinks I let Ethan operate? I am so done for.
Dr. Ford, how is the patient?
Dr. Warren, you are just in time. This resident, he has no license, yet he operated on the patient. I strictly forbade all residents from operating. You acted on your own. This has nothing to do with me.
Dr. Warren, the patient was in critical condition. It was Ethan.
Yeah. Dr. Carter's procedure was perfectly sound. The surgery was a success.
What do you know? He is gambling with the patient's life.
Dr. Ford.
Enough. The hospital has rules. A resident operating on his own is a violation.
So the rule is illegal. Or a human life is.
This is reckless. What if you'd mess up? That is a human life. Would you take the fall?
I was prepared for the surgery to succeed. There was no mistake.
Unrepentant. Ethan Carter, you are fired.
Ethan, you're not off yet. Why are you giving me your books?
Dr. Warren fired me.
What?
You are kidding. Dr. Price handpicked Ethan. Who could fire you? Hold on. I'll call the chief. Dr. Price, someone's trying to fire Ethan.
Keep him there for now.
Yes. I'll keep him here until you get here. What the hell happened? Who does Michael Warren think he is? Firing someone from our ear.
I did the surgery myself.
What? You are just a resident. How could you dare to operate?
That Michael Warren, he is a stickler for the rules. You really stepped on his toes. Hey, I told you to just observe. Why did you operate yourself?
It was an emergency. The kid was already...
He is just making excuses! He is just making excuses, Ethan. You are unrepentant. And you dare spout such nonsense.
Dr. Warren is right. The hospital has clear rules. How could you operate without permission?
Dr. Warren, Ethan? He was just trying to save a life. It was an emergency. The child was dying.
He saved him. That is no excuse for breaking the rules.
Dr. Warren, Ethan broke the rules, but he didn't make a single mistake. The surgery was a complete success.
You are just an associate chief. Who are you to question my decision?
So what if I am an associate chief? I am Ethan's mentor. I know him well. He did this. He must have had his reasons.
Right. Ethan is the top of our class of interns. He wouldn't make a mistake.
I knew you'd object. Fine. Good thing we have the video.
All right. Let's watch it together. All right, let's watch it together. Ethan, what do you have to say about this?
I broke the rules, but life comes first. As a doctor, my duty is to save lives. Rules shouldn't get in the way.
Dr. Price, you see, he is talking nonsense. The video clearly shows how reckless he was.
All right, then let's watch the video.
See? I was right. He is just a resident. And he dares to use meds without permission. This is...
His technique. It is absolutely masterful.
Even some chief physicians can't match this level.
It is over already. 4 minutes, 30 seconds. He finished the surgery. In the whole country, hardly anyone can match that.
Hey, Ethan. You didn't use a ruler. How did you judge the valve size?
My eyes are my ruler.
So what? She is still unconscious. That doesn't mean the surgery was a success.
Dr. Price! Dr. Warren! The girl has woken up. The little girl, she is awake. She bled a lot during surgery, so she was very weak. Dr. Carter performed the surgery and stopped the massive bleeding. She is awake now. All her vitals are stable. She is out of danger.
Dr. Warren, the little girl is awake. That means the surgery was a success. What do you have to say for yourself? Rules are rigid. People are not. You almost made our hospital lose a medical genius. But considering you were just following the rules, it is understandable. Dr. Warren, Dr. Ford. Apologize to Ethan Carter.
Ethan, I am sorry.
Sorry.
Given Ethan Carter's outstanding performance in this rescue, the hospital has decided to promote him to attending physician.
Congratulations! Simulation room. First surgery complete. Reward, world-class hands. Simulation room. Congrats on your first surgery. Reward, world-class hands, world-class suturing, and Phantom 13 acupuncture.
My hands feel so much more nimble.
Congrats! Suturing skill is now maxed out.
Colleagues, we are gathered here today to honor a doctor who, in a crisis, stepped up.
Did you hear yesterday? A resident did surgery.
I heard he saved that little girl with a heart condition.
So the one being honored today is Dr. Ethan Carter. I heard during his internship, he almost got kicked out, and now he is so skilled.
Ethan's in the ER. The ER is really showing off now.
I should have spent more money to get rid of Ethan.
Now, let's give a warm round of applause for Dr. Ethan Carter.
Dr. Carter, you saved my daughter's life. And you saved our family. Thank you.
As a doctor, it is my duty. She is still young. She needs to rest well after surgery. Please be careful when you get home.
Thank you, Doctor.
To honor Dr. Carter's outstanding performance, the committee has decided to promote Dr. Carter to attending physician.
I object!
Ethan Carter just did one surgery and gets a special promotion to attending physician. Then what about us? The doctors who've been here for years. What are we? This decision. I, Henry Moore, am the first to object.
He is right. This is a bit much.
Yeah, that is an unprecedented promotion.
Our promotion system is based on ability. With Ethan's ability, he is fully qualified for the position.
Dr. Moore, Ethan's promotion is a victory for our ER. You are the ER chief. Why are you siding with an outsider?
Because it is unfair. The chief just said. Promotions are based on ability. I know among these residents, there are those more capable than Ethan. But they're still unknown. Of course, I object. I am putting my family on the line. What do you have to say to that?
Who are you talking about?
It is him. Ethan, do you dare to compete with Alex Chapman?
It was just one surgery. I could do that. If you don't dare, it means you just got lucky. You don't deserve the promotion.
Ethan, the hospital's decision is final. You don't have to.
This challenge, I accept.
The challenge is abdominal suturing on a lab mouse. This is a basic skill for every doctor, and it is the ultimate test of fundamentals. The mouse's blood vessels are only 0.3 millimeters, thinner than a human hair. To get a perfect suture is no easy task.
Dr. Moore, this is way too easy. Let's make it harder.
Alex, what are you doing?
A surgeon's hands must be steady. So let's put the mouse on a shaker and suture it.
On a shaker? That is like operating during an earthquake.
The success rate is probably only 1%. He is just trying to make it impossible.
Ethan, don't listen to him. He is just trying to make it impossible.
Ethan, you in. Too scared. Then you're just admitting you got lucky.
I am in.
Let the challenge begin.
Alex's technique is so steady.
Unbelievable. It is shaking so much, and he is still so fast.
Perfect. I can't believe it. He sutured that while it was shaking.
Ethan, you did finish, but your stitches are so sloppy compared to Alex. The difference is clear.
Ethan, suturing a vessel isn't just a formality. You lost.
Suturing a vessel isn't embroidery. It is about reconnecting the nerves.
You lost. Still making excuses.
Ethan's suturing can't be this bad.
Grandma! You have to hold on! Grandma! Doctor, I am begging you! Please save my grandma! She has to be okay!
Don't worry. We'll do our best.
An 80-year-old patient admitted with severe abdominal pain. Initial diagnosis, kidney stones. They're small and in a clear location, so a simple removal will do.
Sounds like a simple procedure.
Dr. Price, since it is a simple procedure, why not let Alex get some practice? If Ethan got a promotion from one surgery, Alex deserves a chance to prove himself. 2.
Dr. White, you are the lead surgeon. And Alex is your resident. The decision is yours.
His suturing on the lab mouse earlier was impressive. With me supervising, it should be fine.
Ethan, just watch me surpass you.
How could this happen?
The stones are too fragmented. This is more complicated than we thought. Let me take over.
Dr. White, I can do this. I can handle it.
Dr. Price, Alex trains very hard. I am sure he can do this. Let's give the kid a chance.
Why is Henry always sticking up for Alex?
What is going on?
Dr. White, her blood pressure is dropping fast.
Oh, no. He nicked the renal artery.
Dr. White, I'll suture it. I can definitely fix it. On the lab mouse, I sutured it perfectly. Everyone saw it.
Ridiculous. This woman is 80 years old. Her blood vessels are aged. They're much thinner than a normal adult's. This is nothing like suturing a few lab mice. You don't even know the basics.
Dr. White, her BP is dropping fast. We have to stop the bleeding now, otherwise she is in danger.
You cut too deep. It'll take time to suture. Sonny, call the blood bank now. Get blood here. Stat.
Dr. White, the blood bank is out. We're getting some from another hospital, but it'll take at least 5 minutes.
Not enough time. She was already weak, and she just lost so much blood. She won't make it 5 minutes.
Even Dr. Price is helpless. It looks like this woman. She's going to die.
This surgery. I'll do it. This surgery. I'll do it.
You are out of your mind. Even Dr. Price said it is impossible. What makes you think you can do it? Don't think that just because you did one surgery, you are all that.
Yeah, Ethan. In the suturing contest, you were the one who lost to me. So right now, stop telling us what to do.
I didn't lose. And I am confident I can suture the vessel.
That lab mouse with cardiac arrest. He somehow brought it back to life. Maybe he really can.
Ethan, you are doing this surgery. Everyone else, assist him.
Dr. Price! Can't! The family's waiting outside. What if Ethan fails? If the family makes a scene, the hospital's reputation will be ruined. Instead, let's wait for the blood. If the patient doesn't make it, it is not our fault.
Yeah, the hospital's reputation took years to build. We can't risk that.
Medical disputes are a hot topic. If this goes viral, who will trust us then?
Family, her condition is critical.
Dr. Carter, I trust you. You promised. You will save my grandmother.
The family has agreed. That is settled. Ethan, start the surgery.
Ethan! What are you doing? What are you doing? Are you trying to murder her?
I have to stop the bleeding first. That will buy time to suture the vessel.
What is your plan?
First, control the blood pressure to slow down the heart's pumping.
But she is an 80-year-old woman. Her heart is already very weak. If you mess this up, she'll die instantly. What makes you think you can control her heart?
Experience.
Experience? You are just a resident. What experience do you have?
Number. Dr. Moore, you forgot. Ethan just performed a congenital heart surgery. That is experience. Ethan, begin. It is the Phantom 13 acupuncture.
The Phantom 13 acupuncture. Isn't that a long-lost technique? He is just a resident. How could he know that?
They say that, with all 13 needles, even the dead can be revived.
Oh no! Her heart stopped! You are a murderer!
She is not dead. She's in a death-like state. Just one last needle. Once I do it, she'll live.
Still making excuses. You clearly killed her. Ethan, you are finished.
Heartbeat's back. Bleeding has significantly decreased. The bleeding stopped.
It is really the Phantom 13 acupuncture. He's alive! He's alive, Ethan!
We've only stabilized the heart pressure. We need to suture the vessel immediately. I need 2 experienced assistants.
I'll be the first assistant.
I'll be the second assistant.
Wow, Ethan's amazing. He's got 2 chiefs assisting him.
Let's begin the surgery.
His speed, his technique, so fast.
That stitch is perfect. It is a work of art.
Now, removing the needles. Anesthesiologist, keep a close eye on the patient's vitals.
Yes, Dr. Carter. All vitals are normal.
Great! He is alive!
He is a miracle worker.
Dr. White, next, we'll remove the stones.
Yes, Dr. Carter. So many fragments. Ethan! You actually removed them all in 5 minutes. This speed. No one in the country can match it.
Doctor. The surgery went well. She'll rest for a few days, and she'll recover. Thank you, Doctor. I'll go take care of my grandma now. I'll make it up to you.
Dr. Price.
Stop!
Dr. Price? Is there something else?
Henry Moore, have you done anything against the hospital lately?
What are you talking about, Dr. Price? I, Henry Moore, have always been honest. I've never done anything wrong.
Really? Then take a look. This is proof that you took bribes from Alex Chapman, all to get rid of Ethan Carter.
So it was you two. You were the ones behind this. So despicable.
Ha! I was wrong, Dr. Price. I beg you, give me another chance.
Effective immediately. Henry Moore, Alex Chapman, you are both fired.
Deserved it. Eva, have you heard? Heard what? The president of a Lowell Medical Group is a total knockout. Imagine, if you could marry a rich woman like that.
I can
How
keep
about
having
it?
surgeries. Dream on.
Quiet, everyone. Lowell Medical Group's donation ceremony will now begin. Please welcome the president of Lowell Medical Group, Miss Charlotte Lowell.
Ethan, isn't that the family member of the patient you saved the other day?
Yeah.
Today, I am here to give a special thanks to someone. He saved my grandmother. To show our gratitude, Lowell Medical Group is donating to the hospital $50 million in medical equipment. And that person is Dr. Ethan Carter. Dr. Carter, thank you. Dr. Carter, here is my card. Take me to dinner sometime.
You are too kind, Miss Lowell. Some other time.
Dr. Carter, when I want something, I go after it. And I always get it. You too. Dr. Carter, we'll meet again.
Dr. Lane, congratulations on becoming ER chief. Here is to you, with tea.
And congratulations on becoming an attending. Now, you can choose a new department. Have you decided where you are going?
Not yet. What is wrong? Dr. Lane.
Ethan, do you know why for years, new interns were always assigned to Dr. Moore?
Was that the hospital's arrangement?
Number. The ER sees all kinds of patients every day. It lets interns quickly learn about all specialties and broaden their horizons.
I see.
But the ER is tough and exhausting. It is high pressure. Many interns just use the ER as a stepping stone. Once they become attendings, they leave right away. Over the years, the ER has lost so much talent. I am telling you this, not to pressure you to stay. It is just that a talent like you, a once-in-a-century genius, if you don't stay in the ER, it is a loss for the ER. And I feel sorry for the ER. But I still wish you a bright future. Smooth sailing ahead.
Dr. Lane, I haven't decided yet which department to join, but no matter where I go, I'll never forget how you've guided me.
Someone's collapsed!
What is wrong? I don't know. He just collapsed. It is his birthday. We saved up for days. We just wanted to celebrate his birthday tonight. He needs to get to the hospital now.
We're doctors from the nearby hospital. Everyone, lend a hand.
I've called you all in late. The ER admitted a patient. He is comatose. The ER ran all the tests, but they can't find the cause. The patient is in the ICU now. Now, I need your consultation.
Dr. Price, the family said, he had occasional headaches, but when he was checked out, they found nothing. So they thought it was just from being tired. They ignored it.
Have a seat and look at the scans.
The scans. They look normal.
Yeah, all the metrics are normal. No intracranial bleeding. No space-occupying lesions. So why did he suddenly collapse?
Dr. Price, everyone. His coma is because of a parasite in his brain.
A parasite?
Dr. Carter, a parasite is obvious. And I, the neurosurgery chief, wouldn't see it.
Neither the blood work nor the CT showed any signs of a parasite. Ethan, you are talking nonsense.
The parasite is right here.
There is nothing there.
It is right here. A tiny shadow. That is the parasite.
Hey! Wait! There really is a tiny one. Ethan, your eyes are incredible. How did you spot that?
A shadow doesn't mean it is definitely a parasite. It could be a small tumor. I suggest an immediate contrast, CT and a brain MRI, for confirmation.
Okay. Do as Dr. Lane suggests. Arrange it now.
Dr. Price, here are the latest contrast CT and brain MRI results.
Put them on the screen.
That shadow. It is moved.
The tumor's position doesn't change, but the shadow has, so it must be a parasite.
Dr. Lane, what is your recommendation?
We need to operate now. The parasite is in the brain. Every second, it could cause irreversible damage.
The parasite's location is tangled with the cranial nerves. This surgery is extremely high risk. We must notify the family immediately and get their consent.
No, time to waste. Dr. Lane, schedule the surgery now. Okay, Ethan, you discovered this. You are coming with us.
Yes, sir.
Doctor, my husband, what is wrong with him?
Your husband has a parasite in his brain. Do you usually give him sashimi or other raw fish?
Number, we're very frugal. We can't afford that. Could it be he drank the tap water at the construction site? He said the tap water was free. He'd just drink it when he was thirsty. I told him not to, but he wouldn't listen.
That must be it. The parasite larvae enter the body. Then through the bloodstream, they reach the brain. He needs surgery now. Otherwise, it is life-threatening.
Can't we avoid surgery? Can't we just use medicine to get the worm out?
Number, the parasite is deep in the brain. Medication can't get rid of it. He needs surgery.
How much will the surgery cost?
About $100,000.
Where am I going to get $100,000? $100,000?
Ma'am, please, calm down. About the money, we'll figure it out. Right now, saving him is what matters.
Yes, saving him is urgent. Without your signature, we can't schedule the surgery.
Answer me, doctor. What is happening?
He is having a seizure. The parasite is attacking his brain. I am afraid there is nothing we can do.
What did you say? He is beyond saving, Dr. Lane, please. You have to save him. He can't die.
With today's medicine, no one can save him. Unless Dr. Miracle is here. We're powerless.
Oh, God. We just wanted to save on water. How could this happen, Michael?
Ethan, what are you doing? He is beyond saving. Can't you just let him pass in peace?
Number I can save him. Let me try. Nurse, 10 milligrams of DSPAM. IV push. And get ready 125 milligrams of mannitol. Start an IV. Push it fast.
Yes, sir. Dr. Carter, what do we do next?
Now, it is up to him.
Dr. Lane, his vitals are normal. He is alive.
Thank you, doctor. Thank you for saving my husband's life. You are a lifesaver to our family.
Please, get up. Don't. It is my job.
In that situation, Dr. Carter remains so calm. He is really something.
How about that? Our ER team is pretty good, huh?
His life is saved for now, but the patient, when he'll wake up, is still unknown.
Doctor, please, you have to save him. I'll die too. Money. Doctor, just save him. I'll even sell my blood. I'll get the money for the surgery. I am begging you.
Please, calm down. Actually, there is another way.
What is the way?
He is comatose because a parasite in his brain is compressing his nerves. We can remove the parasite surgically, and he'll wake up.
Ethan, are you crazy? One mistake in this craniotomy, and he'll die instantly. The safest option now is conservative treatment. As for whether he'll wake up, that is up to him.
If we don't remove the parasite, he'll never wake up.
You think I don't know that? To remove the parasite, the success rate is less than 1%.
Doctor, even if it is just a 1% chance, we have to try. I am begging you, please. Save him.
Since the family agrees, let's take the risk. Nurse, prep for surgery.
Got it.
Dr. Lane, for this surgery, why not have Ethan be your first assistant?
What did you say?
Ethan Carter was just promoted to attending. That alone proves he has what it takes.
True. It was Ethan who first found the parasite. And it was him again who pulled the patient back from the brink. Looks like this kid is the real deal. All right. You'll be my first assistant.
Thank you, Dr. Lane. Dr. Price, thank you for this opportunity.
Ethan, you've done surgeries before, but a craniotomy is on a whole other level of difficulty. You are the first assistant, so you can learn.
Yes, Dr. Price.
I have a few words of advice. Dr. Lane is a neurosurgery authority with vast experience. But he has one quirk. He doesn't like people telling him what to do. So once you are in there, don't say a word. And don't make any decisions. Do exactly as he says. Got it?
Yes, I understand.
This surgery is to locate the parasite. That way, we can avoid damaging other areas. Ethan, bring me the CT report. Good. The location is clear, and it is in the diencephalon. Not a big problem. Let's start. Drill. Strange. The scan clearly showed it was here. Where did it go? Did the parasite move again?
Can we look in other areas?
Number. If we touch other areas of the brain, it could cause irreversible damage.
But if we can't find the parasite, it would devour the patient's brain.
Not good. The patient's vitals are dropping. If we don't remove the parasite, he'll die.
But if we damage other areas, he'll be brain dead instantly.
It is here. It is here. Sure. Sunny, scanner. Scan this spot.
Okay. It is really here. You are amazing, Ethan.
I couldn't find it. The parasite's location. He just pointed it out. Coincidence? No, impossible.
We're lucky to have you. Ethan, the patient's saved.
If this keeps up, my authority will be questioned. Of course! You think I didn't know where it was?
Oh no! The parasite's on the move again!
Oh, no, the parasite's on the move. It is on the left hemisphere. No one can operate in this area and remove the parasite.
But if we don't remove it,
I can remove it. I can remove it.
Do you know what this area means? The left hemisphere is complex, I'd say. In this country, there are very few doctors who can remove this parasite from here.
Dr. Lane told me to stay quiet. But this is an emergency. I can't hold back. The patient can't wait. Dr. Lane, please trust me. Others can't, but I can. I am certain I can remove it.
You? Don't think becoming a chief resident makes you special. How many craniotomies have you done?
Not a single one.
In my career, I've done tens of thousands of craniotomies. I am the authority here. Even I can't be sure I can remove it. What makes you think you can?
I can't say. Because I have the system. The left hemisphere is complex. But with precise hands, the parasite can be removed.
You make it sound so easy. The neurons in there are a tangled mess. You think you can remove it without damaging the neurons? Impossible. All right. I am declaring this surgery a failure. Forcing the parasite out will definitely damage the patient's brain nerves. They'll die on the spot. But if I don't, the left hemisphere is complex. A failed surgery is understandable, and I won't be blamed. Dr. Wang, suture the skull.
Chief! Can't we try one more time?
He has been with me for over a decade, and now he is taking Ethan's side. This is a direct challenge to me. Are you deaf, or has my word lost its weight? I said the surgery failed. Yes. I told you. Conservative treatment. You insisted on surgery. Great. You gave them hope, and now you've failed. I am going to tell the family. You think about it. How you'll explain this to them.
As a doctor, as long as there is a chance, we have to try.
What are you doing? Are you going to operate on your own?
The parasite is in the left hemisphere. We have to operate now.
Dr. Moore already said, the surgery failed. The surgery failed. If you force this surgery and get blamed, Who is responsible?
If we're just worried about blame and give up on him, then what are we, doctors?
But...
He was just trying to save money. He drank unboiled water for years, and that is how he got the parasite. And today is his birthday. He and his wife wanted to celebrate, so they splurged on a barbecue. Do you really want his birthday today?
As medical professionals, saving lives is our duty. Ethan, I believe in you.
All right, Dr. Carter. I'll be your assistant.
Okay.
But the parasite's location is too hidden. Finding it is impossible.
There's only one way now.
Could it be Phantom 13 acupuncture?
Yeah. We'll use the Phantom 13 acupuncture.
Ethan, you actually know the Phantom 13 acupuncture.
The Phantom 13 acupuncture? You actually know the Phantom 13 acupuncture.
The Phantom 13 acupuncture can control the body's organs. First, we'll modify the brain's nerves. That way, we won't damage the patient's brain nerves.
Control the body's organs today. I'll finally get to see the long-lost Phantom 13 acupuncture.
Let's begin.
Doctor, my husband will be okay, right?
Don't worry. Dr. Lane is our hospital's top neurosurgeon. He'll save him.
How is it going?
Still in surgery.
Doctor, who is my husband?
I am sorry. The parasite burrowed into the left hemisphere. It was impossible to remove. The surgery failed.
How could this be?
Ma'am, come on. Get up.
How could this happen?
The left hemisphere is complex. You did your best. It is not your fault.
Where's Ethan?
Still, in there.
Oh, no. Dr. Lane, why did you leave him alone in the OR?
What is the problem?
You don't understand. He has done this before. While the lead surgeon was out, he operated on his own.
How dare you! Stop! Who told you to operate?
You! Why are you operating on your own again?
I told you to just suture the patient! Are you ignoring my orders? What?
Parasite removed.
The left hemisphere. The neural network is incredibly complex. Forcing the parasite out like this will definitely damage the patient's brain nerves. Just to show off, you are risking the patient's life. You have no ethics.
I am making sure not to damage the patient's brain nerves before I operate.
Dr. Lane, this isn't the time to argue. Let him finish the surgery first.
But I trust Ethan. Dr. Carter, proceed.
Begin suturing.
Again.
Done. It is over. Take the patient to the ICU and keep a close eye on them. Contact me if anything happens.
Mm-hmm.
I used the Phantom 13 acupuncture to protect the patient's brain nerves in advance, so their nerves won't be damaged.
Phantom 13 acupuncture? You mean the long-lost Phantom 13 acupuncture?
Dr. Lane, you didn't know Ethan had this trick up his sleeve, did you? When we first saw it, we were all shocked. That is why I told you not to worry.
That is right, Dr. Lane. Ethan is the star of our AR.
Dr. Price, this can't just be the end of it.
Dr. Lane, the surgery was a success. What is the problem?
The surgery was fine. But Ethan staying in your air is the problem. I have to poach him. The surgery was fine, but Ethan staying in your ear is a problem. I have to poach him. Chief, when you recruited me, didn't you promise me that in neurosurgery? It was my call. This is my oar. Without my permission, he operated on his own. This needs to be dealt with seriously.
But Ethan already finished the surgery. What can you do now?
Chief, you can't blame Ethan entirely.
Dr. Lane, Ethan was just trying to save a life. He didn't do anything wrong.
Dr. Lane, this matter. I'll handle it.
Oh.
Ethan, your craniotomy was so perfect, and the neurosurgery chief still gave you a hard time. That is just so unfair.
You think you just go into the OR, do the surgery, and that is it. It is not that simple. When you are the lead surgeon, just do what you are told. Don't be like me, don't take initiative.
Not me. Hey, Ethan, you've done 3 or 4 surgeries. When do I get to lead one? But I wonder what the chief of staff will do. Dr. Lane, what is going to happen?
Ethan, this time, Dr. Lane, he is not going to let us go.
What is the deal with Dr. Lane? Is he really that scary?
You new guys don't know. Dr. Lane is a renowned neurosurgery expert and an absolute authority. Dr. Price had to really work to recruit him. He poached him from another hospital.
So he is an expert. Ethan successfully finished the surgery. Shouldn't he be praised for that? Why is he giving him a hard time? Ethan pulled off the surgery. He should be praised, not punished. So why is he being given such a hard time?
Dr. Lane is famous for his expertise, but his authority is also feared by all. They say in neurosurgery, no one dares to contradict Dr. Lane. Ethan, you went into his OR and operated on your own. That is clearly challenging his authority. You idiot, how could you be so reckless?
You were there. It was an emergency. I had no choice. You know that?
So what about his authority? He couldn't do the surgery, but Ethan could. He can't argue with that.
Of course I know. You still don't realize how serious this is. At the end of the day, Ethan operated against protocol, and he challenged Dr. Lane's authority. Worst case, he could get fired.
It can't be that bad.
Dr. Carter, the Chief of Staff wants to see you.
Do you know what it is about?
I think it is about Dr. Carter's surgery. I am not sure of the details.
Just what I was afraid of.
Dr. Lane, what are we going to do?
Ethan, when you go up there, apologize to Dr. Lane first. Once he is cooled off, everything will be easier.
I understand. Nurse Lucy, go on ahead. I'll be up in a minute.
Almost like Ethan's really getting fired this time. I have to tell Dr. Warren.
Dr. Warren, great news! Ethan did another unauthorized surgery. Dr. Lane from neurosurgery reported him to the chief of staff. He wants him fired.
What?
Ethan did another unauthorized surgery. Dr. Lane from neurosurgery went to the chief of staff to report him. He is getting fired. Dr. Warren, last time, Ethan made us look like fools. If he really gets fired, let's see if the ER staff still have the nerve to be so cocky.
Ethan may be reckless, but he is a rare talent. I was going to make a move before he chose his department and find a way to get him into our cardiac surgery. And now this happens. No way. I have to save him, no matter what. I am done talking to you.
Michael, what is the rush?
Oh, something urgent. Catch you later.
He is never this rushed. Lucy, Michael was in such a rush today. Did something big happen in cardiac surgery?
Not that I know of, but I think Dr. Warren heard that Ethan from the ER is getting fired, so he rushed off.
What? Ethan's getting fired. No wonder Michael was in such a rush. So he is after him too. No way. I can't let him beat me to it.
Dr. Price. In all my years, I've never seen a doctor dare to operate in my or without permission. This is complete madness.
Dr. Price, it was an emergency. I had to save him. Besides, I only operated because I was certain.
Dr. Price, Dr. Lane, Ethan was trying to save a life. Besides, he has some surgical experience.
Those minor surgeries. How can they compare to a craniotomy? A craniotomy's complexity is far more difficult than you think.
Yes. What? The surgery was a success, wasn't it? The patient's fine. Dr. Lane, do we have to make such a big deal out of this?
He just got lucky. Dr. Price, Ethan operated without permission. That is a serious violation of hospital rules. He must be punished severely.
What is with Dr. Lane? He's so hot-tempered.
Dr. Lane.
All right, enough. According to our hospital's rules, Ethan should be fired immediately. Dr. Lane, what do you think? According to our hospital's rules, Ethan Carter should be fired immediately. Dr. Lane, what do you think?
No way. I just became an attending. Am I really getting fired this soon?
Dr. Price, Ethan was desperate to save a life. It was understandable. Please, don't fire him. You idiot. You just became an attending, and you are already getting cocky. Go apologize to Dr. Lane. Go on. Just save your job first. Go.
Well, firing him is too harsh.
Oh. Then, Dr. Lane, what do you think we should do?
Ethan is from your ER. Since the ER won't handle him, then neurosurgery will.
Or are they gonna fire me? Why do they want me in neurosurgery now? What is Dr. Lane up to?
Ethan, well, do you agree?
I
disagree!
Dr. Warren. Dr. White. What are you two doing here?
Dr. Price, about Ethan's congenital heart surgery. It was a huge success. He is a natural for cardiac surgery. How about this? Let him join my department. I'll mentor him myself.
Nonsense. He is clearly better suited for nephrology. And I'll be the one to mentor him. Ethan, come to nephrology. I'll make you a chief in 3 years. Deal?
Since when do you two get a say? Join my neurosurgery. I'll show you. Oh, what real medicine is.
Now I get it. You are all here to poach him.
Brian, you just realized?
You playing dirty.
So, what if we are?
Exactly. I want Ethan.
Oh, alright. Where he goes is up to Ethan.
Ethan, so, where to?
With me.
What is there to think about? You'll be a chief. Go on.
Come to my department. Come with me.
These guys combined are almost a few hundred years old. Why are they acting like kids? But I have to choose a department eventually. So I'll just decide today.
Hospitals have rules. You are just a resident. You operated without permission. That is a violation.
So the rule is illegal. Or a life is.
You are out of line. What if something went wrong? That is a human life. Can you take responsibility?
I was prepared for a successful surgery. I won't make a mistake.
You are unrepentant. Ethan Carter. You are fired.
Actually...
Penny, come on.
We've only temporarily controlled the pressure. We have to suture the vessel now. Right now, I need 2 experienced assistants.
I'll be your first assistant.
Dr. White. Next, we'll remove the stones.
Yes, Dr. Carter. Ethan, you did it in just 5 minutes. All of them. This speed in the whole country, no one can match you.
I think...
Dr. Carter, the parasite was so obvious. You think high. The neurosurgery chief wouldn't notice. Just to show off, you risk a patient's life. That is a complete lack of ethics.
Ethan, want to go in and observe? Okay. I'll arrange for you to observe.
Thank you, sir.
I am a professional mentor. I know him well. He did this. He must have had his reasons. Many interns use the ER as a stepping stone. Once they become attendings, they leave right away. Over the years, the ER has lost so much talent.
Dr. Moore gave me a chance. I can't forget that. Dr. Price, I've decided. I am staying in the ER. I've decided. I am staying in the ER.
Ethan, you need to think this through. Once you choose a department, it is not easy to switch.
He is right, Ethan. The ER is extremely demanding. It is the most intense in the whole hospital. Don't you want an easier job?
Exactly. Our pay and bonuses in cardiac surgery are much higher than in the AR.
If you stay in the ER, you'll never become a true expert.
What you are all saying is nothing to my system. It is all irrelevant. The ER sees a huge number of patients daily. I feel they need me more there.
Well said. As doctors, wherever there are patients, that is where we should be. Chiefs, since Ethan has made his decision, we should respect his choice. That is settled. Ethan stays in the ER. Back to work.
Ethan, hang back. I need to talk to you. You are crazy. Neurosurgery, cardiac surgery, or nephrology. Any of those is better than the ER. They're all fighting over you. So why do you still want to stay in the ER?
Chief, weren't you just yelling at them for poaching me? And that you were going to fight them. So why are you telling me to go now?
I was just defending the ER's honor. They were playing dirty. Of course I was going to fight them. But this is about your future. With your talent, you deserve a better department. Tell you what, go home and think it over. Let me know what you decide. At worst, I'll swallow my pride and beg the Chief of Staff to get you transferred.
Chief, you begged the Chief of Staff for me. I made the right choice. Chief, I wasn't kidding. I really want to stay in the ER. To learn from you. Really.
Great. That is wonderful. Ethan, will you be my apprentice? Actually, I've been wanting to take on an apprentice. I just never found the right person. But now I have.
It is an honor, Dr. Lane. If you'll have me, I'd be honored.
Good. From now on, you are my apprentice. If anyone dares to bully you, I'll have your back.
Okay. Master.
Ethan, what did the chief say?
Well,
they said they're firing me.
You are so brilliant. And they're firing you. No way. I am going to talk to the chief.
Hey. But Dr. Lane from neurosurgery said, forget it. He is letting me stay.
I knew it. An apology was all it took.
But they have one condition.
What condition?
It is. I have to go to neurosurgery.
What? Neurosurgery? Neurosurgery! Neurosurgery isn't for just anyone. Ethan. Dr. Lane himself asked you to go.
I wanted to go to neurosurgery, but they didn't want me.
That is our Ethan. He lets his skills do the talking.
But Dr. White from nephrology and Dr. Warren from cardiac surgery, they're against it.
Why? What has it got to do with them? Right. What has it got to do with them?
Because they both want me in their departments.
You mean 3 departments are fighting over you? My God. Life is so unfair. Big shots are fighting over Ethan and me. I am still your assistant.
Ethan's handsome and brilliant. In the hospital's history, no other doctor has ever been fought over by 3 departments. He is my perfect dream guy.
But Ethan's about to leave the ER. It'll be hard to see Ethan after this. Hey, Ethan. Which department are you going to?
I turned them all down.
All of them?
Why would you turn down such a great opportunity?
Because I am staying in the ER.
You are really staying in the ER.
Yep. Because I can't leave. You all?
Ethan's staying in the ER. Hooray for Ethan!
What is bothering you?
Doctor, for the past 3 months, my son's been acting strange. His legs and feet are numb and weak. Sometimes he can't even lift his arms. Doctor, my son doesn't have some kind of incurable disease, does he?
Easy. Let's get the full picture first. When you wake up, can you get out of bed?
Yeah, that is it. It is like I am paralyzed.
When your limbs feel weak, do you have any spasms? Have you lost weight?
I don't know.
I think so. He has definitely lost weight in his face.
Any diarrhea?
Yeah, Allah.
He's already got it. I can't see a thing. The gap between us is so huge.
Doctor, my son, he doesn't have ALS, does he? Doctor, my son, he doesn't have ALS, does he?
Ma'am, don't worry. Your son just has hyperthyroidism. It is not serious.
Really?
Yes, we'll know for sure after the tests. Sunny, take them for the tests.
Ethan, without any tests, he knew it was hyperthyroidism. He is so confident. Okay. Follow me. Here are the results.
Confirmed. It is hyperthyroidism.
Doctor, is my son's condition serious?
It is mild. He should eat more kelp, mushrooms, and other potassium-rich foods. He'll get better on his own.
Thank you, Doctor.
You are welcome.
Ethan, you're amazing. Without any tests. You knew it was hyperthyroidism.
Was it that hard?
Yeah. Ethan. Look at the group chat. Ethan. Check the group chat.
Welcome Charlotte Lowell, CEO of Lowell Medical Group, to our family. Charlotte is my graduate student. She'll be doing clinical rotations at the hospital soon. If she is assigned to your hospital, please look out for your senior fellow.
Hi everyone, I am Charlotte Lowell. I look forward to learning from you all.
Welcome, senior fellow.
Hi, senior fellow.
Looking forward to meeting you, senior fellow.
No way, Miss Lowell. Is now our senior fellow?
Dr. Carter, we'll meet again.
This is too much of a coincidence.
Ethan!
Graduation's next Friday. We should all get together.
Heard the class president was in surgery. This year's top graduate. Is definitely the class president.
It was just a small surgery. Nothing to mention.
Show off. Thinks he is so great for doing one surgery.
You too. Stop.
Miss Lowell's really here.
You all know Miss Lowell, right? She is pursuing a master's in medicine. She'll be in our AR for clinical training. Please be cooperative. Miss Lowell, I'll leave her in your hands.
Yes, Dr. Price.
Well, Miss Lowell, I'll be going now.
You all heard that, right? You need to take good care of Miss Lowell.
Hi everyone, I am Charlotte Lowell. Here, there is no Miss Lowell, just medical staff. So, you can call me Dr. Lowell, or just Charlotte.
Dr. Lowell is new here. She's not familiar yet, so who can show her around?
I think Dr. Lewis is a better fit. He is from our alma mater. He is a better fit for a senior fellow.
Dr. Lewis. Actually, let's have Ethan do it.
Why let him?
Dr. Carter. We meet again. We meet again.
Small world.
Not a coincidence. Didn't I tell you we'd meet again? I came here on purpose for my clinical rotation.
What? How?
Since the chief assigned me to you, adding you on WeChat isn't too much, is it? Now, we're basically colleagues. You are an undergrad. I am a grad student. So, you should call me senior fellow, right?
Huh.
Senior fellow. Let me scan you.
Dr. Carter, a pregnant patient just arrived. You need to see her now.
Doctor, please, check her. What is wrong with my wife?
It hurts. I am going into labor.
Doctor, please, check on my wife. What is wrong with her?
Hurts. I'm going into labor.
Doctor, please, save us.
Relax. We're here. Your wife will be okay. Good. Her water hasn't broken. Relax. She is not in labor.
That is a relief. But, doctor, my wife suddenly has severe stomach pain. So, is it something wrong with the baby?
Don't worry. Let's run some tests. Sunny, take her for an ultrasound and blood work.
Okay. Come on. Ethan. The test results are in.
It is appendicitis.
Appendicitis?
But she is 6 months pregnant. If we don't remove the appendix, it could lead to a threatened miscarriage or premature birth.
A miscarriage?
If it is severe, it could be life-threatening.
Life-threatening? Doctor, you have to help us.
We have to remove the appendix.
Okay, I'll do whatever you say. Doctor.
I don't want surgery. No, wait. Number, I don't want surgery. Number, no.
Don't worry. An appendectomy is a minor surgery. It is okay.
Surgery requires anesthesia. I struggled so hard. To get pregnant, I won't.
If you don't have surgery, your life will be in danger.
Doctor, please. I want to save my baby. Is there any way to avoid surgery? Or without anesthesia?
No.
Impossible. You'll die from the pain without it.
Ethan, do something. We can't just watch a mother lose her baby.
Save the mother. Save the baby, too. Is there? No. Way to save both.
Doctor, don't listen to my wife. Save her. Save her.
Don't worry. Our priority as doctors is to ensure the mother's safety, no matter what.
Number, I won't. I want my baby.
Listen to the doctor. It is okay. We can have another baby. We can just try again, okay? You are so important to us. Without you, I can't go on. Without you, I can't go on.
But I don't want to lose our baby. Honey. He has been in my belly for so long. He kicked me just the other day. I can't lose him.
Doctor, what do we do? Is there anything you can do?
Don't worry. We'll find a way. Trust him. He'll find a way.
Oh, what do I do? What should I do?
Host detected. Facing a tough choice. Reward world-class appendectomy technique.
Unbelievable. This time, no simulation needed. I just learned the skill. I've mastered world-class appendectomy technique. Not only can I perform appendectomies, I've also learned all the specialized knowledge. I am sure I can find a solution. To minimize the anesthetic's harm to the baby, the most direct way is to control the dose. Right. We can use local anesthesia. That way, the dose can be minimized. We could use local anesthesia. That way, we can keep the dose to a minimum. But still, it is still anesthetic. It is bound to affect the baby. Is there another way?
No,
Anesthetic! No anesthetic!
No. There's another way.
Doctor! Do you really have a way? Is there really a way?
There is. But it'll be tough. It'll hurt.
As long as my baby is safe, I can take the pain.
Doctor, just tell us. What is the way?
Local anesthesia.
Right. Local anesthesia. It reduces the dose of anesthetic.
Okay, local anesthesia. Local anesthesia it is. We'll do whatever you say, alright?
No. Local anesthesia. That is still anesthetic. I can't let my baby get hurt. I refuse.
Don't worry. We'll reduce the dose of anesthetic to protect your baby.
Yes. Listen to the doctor.
I refuse. No anesthetic.
When I said local anesthesia, I meant no anesthetic.
What?
When I said local anesthesia, I meant no anesthesia.
What?
No, anesthesia.
What kind of surgery uses no anesthesia at all? That is impossible.
Doctor, this isn't a joke. Look, I don't know anything about medicine, but even I know that for surgery, you have to use anesthesia.
Ethan, don't you have another way?
Anesthesia is to block nerve conduction and numb the patient. As long as there is a way to block nerve conduction, then we can achieve the same effect without it.
But besides anesthesia, there is no other way to block nerve conduction.
We can use acupuncture to achieve this.
Acupuncture?
Right, that is what I meant. When I said it would hurt, the needles will definitely hurt.
So, acupuncture, I can take it.
But from what I know, experts in acupuncture are all old Chinese doctors. You are so young. Can you do it? Look, doctor, let's find a more experienced doctor. Okay.
This surgery, only I can do it. Only I can do this surgery.
His confidence, so handsome, please. Don't worry, Dr. Carter. He is brilliant. He saved my grandmother. Please, trust him.
Doctor, but this is 2 lives at stake. Doctor, let's find a more experienced chief to do it. Cost doesn't matter. I don't care. As long as my wife and baby are safe. That is all that matters.
Ethan, don't take it to heart. I trust you completely.
Ethan, I trust you too.
It is fine. After all, 2 lives are at stake. It is understandable for the family to be cautious. At worst, I'll be the chief's assistant. It is fine. I'll call Dr. Lane right now.
Thank you, doctor. Honey, you are saved.
Dr. Lane, we have a patient here who needs you.
Thank you for understanding. They mean everything to me.
It is okay. I understand.
Chief. Dr. Lane.
Dr. Lane, she's 6 months pregnant. Acute appendicitis. She needs surgery right away.
Dr. Lane, Dr. Carter said only he can use acupuncture for local anesthesia. But we still want you to do it.
Acupuncture?
Yes.
You mean?
Exactly. Phantom 13 acupuncture.
What? Phantom 13 acupuncture? That technique was lost long ago. Ethan actually knows that. Amazing.
He is right. This surgery, he is the only one who can do it.
Is that true? But...
All right. If you're really worried, for the surgery, I'll be Dr. Carter's assistant.
What? You are a chief physician, and you'll be his assistant.
Dr. Lei, actually, that is fine.
You don't understand. Dr. Carter's acupuncture for local anesthesia is a family secret, a rare technique, and it is true, he is the only one who knows it.
This secret acupuncture, it is true. Only he knows it.
This secret acupuncture. But...
Don't worry. During the surgery, I'll be right there, watching. She'll be fine.
He is staking his own reputation on me. I can't let him down.
All right. I am counting on you, Dr. Carter.
Don't worry. It is my duty.
Dr. Lowell, you'll be the second assistant. Learn from it.
Okay, thanks, Dr. Lane.
Dr. Lane, what about me?
Come along.
Thanks, Dr. Lane.
This is my first official surgery. As the lead surgeon, I have to nail this. During the surgery, if you have any problems, just let me know.
Please, Doctor.
During the insertion, it might sting a little, but it'll be over soon.
I am okay. For my baby, I can take it.
Scalpel. How are you? Do you feel anything?
Has it started? I don't feel a thing.
I told you so. Then, let's begin. Let's begin. It is over.
Doctor, why are you all out so soon? My wife, is she okay? Doctor, you are all out already? My wife, is she okay?
The surgery's done, so we're out.
What? You just went in less than 10 minutes ago, and the surgery's already done. Oh, that is so fast.
Now you see what our Dr. Carter is made of, right? This time, thanks to Dr. Carter. The surgery was a success. Both mother and child are safe.
Thank you, Doctor. You really saved our lives. I have to bow to you.
Get up. It is my job. Keep a close eye on your wife. If there's any problem, call us anytime.
Oh, okay.
You rascal. Well done. You didn't let me down.
It is all thanks to you.
I had no idea Ethan was this amazing. Looks like this year's top graduate. Is a no-brainer.
Ethan, can you make me the first assistant and let Dr. Lowell be the second?
But I am training Dr. Lowell today. She did a good job about being the first assistant. You still have a lot to learn. But the tuition, well...
I get it. Ethan, your shoulders are sore, huh? Let me rub them.
My left shoulder, too.
Left shoulder? Like this.
From surgery today. My hands are killing me.
Your hands hurt. Here, like this. Like this.
My mouth's a little dry, too.
Ethan, what kind of bubble tea do you want?
I want...
What do you want?
Mango, pomelo, sago.
Ethan today. Thanks for letting me scrub in. My treat for bubble tea.
Thanks.
But I have to go. I am leaving now.
Mango, pomelo, sago. So, the bubble tea, still want it?
Of course, I do. Besides, I've got a big stomach.
Alright.
Hurry and get changed. We have the class reunion later.
Oh, right. I'd forgotten. I can't wait to see how arrogant the class president is.
Oh! Are you done yet? It is taking you forever.
Done.
It is just a meal. Why so dressed?
It is a rare class reunion. Of course, I have to wow everyone.
Let's go. Time to eat.
Let's go.
Long time. No see.
Long time. No see.
Ethan! Sunny! You're here! Have a seat! Have a seat!
Class president, I heard you are at Capital Medical Center. That is the best hospital there is.
Indeed. Capital Medical Center isn't for just anyone. Without real talent, you can't get in. I just worked a little harder. Than everyone else, just a little Ethan. Which hospital are you at?
Sunny and I are at City General.
City General, huh? Compared to Capital Medical Center, it is a step down. But don't be discouraged. Work hard for a few years, and you might be able to transfer over.
PFF'd? Big deal.
At the hospital, have you seen the senior fellow? I heard she is gorgeous.
Right. I want to see her too. I've searched my whole hospital everywhere, but no sign of her.
She is so brilliant. She must be at Capital Medical Center. Class president, have you seen her?
Capital Medical Center is huge. I haven't seen her yet. But eventually, I am sure I'll run into her. After all, brilliant people always find each other.
She is at...
Sorry to keep you waiting.
Have a seat, sir. Have a seat, senior fellow.
Okay, have a seat. Everyone, sit down. Today, I brought Charlotte here on purpose. Lowell Medical Group is a well-known medical company. So, you all need to do your best. If in the future, you can join Lowell Medical Group, that is a great option.
Not at all. We're all classmates. We can learn from each other.
She is so beautiful. Like a goddess.
Tell me about it. If she were at my hospital, I'd go see her every day.
Must be nice being the class president. He gets to be with her at the same hospital and see her often.
Only someone as exceptional as me is worthy of working with her. But why haven't I seen her? Senior fellow, I heard you are doing your clinicals. But I am at Capital Medical Center, so why haven't I seen you?
Yeah, the class president's there too. Perfect. You two can keep each other company.
I am not at Capital Medical Center. Huh? Then, which hospital are you at? I am at City General. I am at City General.
Senior fellows at City General. So that means Ethan and Sunny are at the same hospital. You two are something else. Senior fellows at your hospital, and you didn't say a word.
You all were having such a good time, so I didn't want to interrupt.
City General, it is no Capital Medical Center. Who'd believe us anyway?
So what if you are at the same hospital? You two are so incompetent. You and the senior fellow could never see eye to eye. Only I can connect with the senior fellow. We're on the same wavelength. Senior fellow, I heard you switched majors for your masters.
Yeah. I didn't study medicine as an undergrad. Before I got into medicine, I didn't know much about it. But the more I learn, the more I realize how complicated it is. So, that is why I am doing clinical rotations.
She is right. So much knowledge is learned in the clinic. Like at Capital Medical Center, we only get the toughest cases, and we're surrounded by experts. There is so much to learn, so much.
Right. I just observed an appendectomy. I really learned a lot.
What a coincidence. I observed one too. An appendectomy. See, I am the one who can connect with the senior fellow.
Senior fellow, so who did you observe? Which expert? A famous one. We all know them.
Observed Ethan Carter. I am learning from Ethan.
What? Senior fellow, you mean you are learning from Ethan?
Yup. He is the lead surgeon, and I am his second assistant.
Whoa, Ethan, you are already a lead surgeon, and you have the senior fellow as your second assistant. Awesome, Ethan.
Not really. It was just a small surgery. You'll all get there. You'll be in the year 2.
Our Ethan, so humble. Unlike some people, they assist on an appendectomy and want the whole world to know.
PFF'd. It is just an appendectomy. Anyone would think he'd done some major surgery. I've assisted on an appendectomy too, and it was at Capital Medical Center with a renowned professor. When it comes to skill, I am still better.
It is good to see you all working so hard and taking your work seriously. I am very pleased. I always say, my students are never second-rate. I've heard that this year's outstanding graduate will likely come from among you. This year's outstanding graduate will be based on your overall performance. The highest overall score wins. This includes your number of surgeries, stitches, and whether you were the lead surgeon. Then, your department chief will submit your scores to the school. The highest overall score is the outstanding graduate. Charlotte told me. The outstanding graduate will be hired by Lowell Medical Group with a high salary.
That is right. At Lowell Medical Group, we value talent. If you have talent, our doors are always open.
Wow, Lowell Medical Group. I want to be the outstanding graduate too. But in the past 6 months at the hospital, I only scrubbed in once. Stitched 3 or 4 times. Never led a surgery.
My record's about the same. Looks like we're out of the running.
Class president, what is your score?
I've never led a surgery either, but I've scrubbed in for 4 or 5 surgeries, and stitched up over 10 times. My record is just so-so.
That is our class president. You are so impressive.
You are amazing.
Ethan, have you calculated your score yet?
Have you calculated what your score is?
Number, but my score probably isn't high. After all, I've only led one surgery, an appendectomy.
Just as I thought. So what if you led a surgery? It is about your overall performance. In the end, I am still the stronger one. This outstanding graduate title. I've got it in the bag.
Looks like the outstanding graduate title is definitely the class president's. Later, if he goes to the Loa medical group, he'll be a huge connection for us.
True.
Come on, let's go toast the class president. Then, he'll help us out.
You're amazing, class president. So amazing.
If you go to the Loa medical group, don't forget about us.
So amazing. To you.
What is so great about him? He has never led a surgery, and he still has the nerve to show off.
Sure.
Let him show off. We're the type to keep a low profile.
That is true. But if he actually gets it, we'll have lost out big time.
It is fine. Didn't the professor just say that this time the chief is grading us?
That is right. The chief really likes you. He'll definitely give you a high score.
Let's just wait and see. The higher he climbs, the harder he'll fall.
Class president, this year's outstanding graduate. It has to be you, right?
No problem. Of course it is.
Ethan. Look, it is Charlotte. She came just to see you win.
She said Ethan's winning an award.
Winning an award? Ethan, all dressed up today. He didn't think he was here. To win an award, did he?
No. It is graduation. It is only right to dress up.
That is good. I was worried you'd prepared so much, only to have it all be for nothing. I heard. Our chief gave me a very high score. This year's outstanding graduate is definitely me.
Then, congratulations, class president.
Actually, you are already very good. But when it comes to overall strength, you are still just a little bit short.
Right. I should learn from you.
Since we're classmates, you can train at City General for a few years. When I am at Capital Medical Center and become chief, I'll find a way to bring you under my wing.
Okay, thanks in advance. Class president.
Ethan. Just hearing him talk makes me want to punch him.
It is an honor. The school administration has asked me to present this year's Outstanding Graduate Award. And now, this year's Outstanding Graduate is... This year's Outstanding Graduate, I am so proud. He is from my class. It is me.
See that? The professor just looked at me. I am up next. Remember to take a lot of pictures.
He is... Ethan Carter. Let's welcome Ethan Carter to the stage.
First, thank you to the school for all its support. Next, thank you to the teachers for their hard work. As medical professionals, we must always remember that we are our patients' last line of defense. In the days ahead, we must use our expertise and hard work to hold that line, so that all our patients can recover and be healthy. I'd like to thank someone who has always been there for me, working silently to support me.
You are so brilliant, and they're still firing you. No way. I am going to talk to the chief of staff. Dr. Price. Ethan's internship grades are always first place, but Dr. Moore just won't let him stay. It is really the Phantom 13 acupuncture. He is alive. Ethan, I believe in you too. Alright, PFFT. What is so great about him? He has never even led a surgery. And he still has the nerve to act like that.